Aloha, everyone. I hope you've been doing your deep breathing exercises every day. Welcome to Dr. P's Facets of Life series of podcasts. This is pod number 47. Today's topic, post-cancer recovery. I want to begin by congratulating you on the completion of your treatment programs, or nearing completion if that's the case. I want to talk to you about what lies ahead and how you might proceed from here. I think it's safe to say that your life may never be the same after cancer. However, it can be better in many ways. Once treatments end and recovery begins, this new part of your life's journey can present you with hope, happiness, and also some fear. The fear of relapse or reoccurrence is common among survivors. Anniversary dates can be intense and anxious, albeit rewarding and uplifting for some of you. Aches and pains can trigger fear and anxiety. It's kind of like being bitten by a snake, in that you never forget the experience and you may forever be afraid of the thing that bit you. The process of returning to what you consider to be a normal life can be very challenging. But then you're no stranger to challenges, are you? Your primary focus needs to be on figuring out what you can do to begin living without cancer. And a key element of that focus is to keep in mind that what used to be normal for you may need to be redefined. And that needs to be okay with you. It needs to be really okay. Life-changing situations, good or bad, often give us the chance to grow, learn, and appreciate what is most important to us. This journey you've been on can present opportunities for you to look at things in a different way. So, try to embrace this new view and build on it as you move forward. In terms of moving forward into the future, any plans you make should have some specific goals in mind. One of those goals should be for you to learn to be patient with yourself, with others, and with the process. You are likely to be entering what may be uncharted waters for you. Another goal should be to not lock yourself in your pre-cancerous past. You know, we have an opportunity every day when we wake up, assuming we're lucky enough to wake up, to create a new reality for ourselves and a new personal history. Let's talk a little now about follow-up care. It's really important that you see your doctor for regular checkups per his recommendations. That could be every 3 to 4 months for 2 or 3 years, or it could be less, depending on your particular set of circumstances. Both you and your doctor need information in order to best manage your care. I suggest you keep a log or journal to keep track of symptoms, changes, problems, and anything you feel that might be relevant. At each visit, make sure you mention any problems you may be having. Following are some examples. Any new symptoms or pain that is unusual or troubling, tell your doctor. Any physical problems that interfere with daily life, tell your doctor. Any new medical issues, including treatments and medications, be sure to include vitamin supplements and herbal remedies in that list. Any emotional problems, such as anxiety or depression, tell your doctor. Make sure the doctor answers all your questions to your satisfaction. Then make notes in your log or journal. Sometimes it's helpful to have someone accompany you to your appointment so that you can have an extra pair of ears. Follow-up care can also include home care, occupational therapy, vocational therapy, physical therapy, and support groups. Check with your insurance company to see what kinds of follow-up care is allowed with your coverage. Your doctor can assist you with all the resources available to help you with other forms of help and assistance, most appropriate for your situation. Now, let's talk about managing any physical changes that may occur. Some have described survivorship as being disease-free but not free of the disease. You may find that you are still coping with the effects of treatment on your body. It can take time to get over these effects. It might be helpful to mention some of the most common experiences people have encountered. Fatigue is a normal part, but varies with each individual. There can be memory and concentration lapses. This is sometimes referred to as chemobrain. Pain. There can be pain. It should be recorded in your log and then reported to your doctor. Pain should be managed aggressively. Do not take the, "oh, I'll just tough it out" attitude. That is counterproductive. There could be swelling, neuropathy, trouble swallowing, bladder and bowel control problems, and changes in eating habits which might affect body weight adversely. Remember that you have been traumatized, both physiologically and psychologically. Understand that because of that fact, you need to be patient with yourself and with the recovery process. How about your emotions, how you feel? Well, worrying about cancer coming back is very normal, especially during the first year after treatment. For some, any new symptom or abnormality conjures up anxiety about the possibility it could be another cancer. This is an example of not being free of the disease, because it is still in your mind. As time goes by, those feelings should diminish. Although there may be plenty of room for negative emotions in your mind, try to find as many reasons as you can for positive thoughts and emotions. When you do that, you unknowingly help strengthen your immune system. This is one of the goals in the recovery process. In order to facilitate this strengthening process, I suggest you employ relaxation techniques, which will reduce stress, give your mind and body well-deserved respite, and promote a more positive attitude overall. Additionally, find ways to remove and/or minimize the stressors in your life. You know, chronic stress suppresses the immune system and can impede the recovery process. Finally, let me state that I believe everything in life is a choice. We behave our way through all things, good, bad, and everywhere in between. We always have a choice to make the journey easier or harder. Choose to accept help. Choose to give yourself credit for things you've accomplished. And choose to be grateful every day. Well, folks, that's it for this time. My hope is that this has helped you in some small way. Remember that gratitude is the best attitude. This is Dr. P saying aloha.